We are always looking for ways to predict how patients will fare after treatment with drug-eluting stents. Now in the European Heart Journal, researchers report on an analysis of the patients in the SIRTAX trial, which compared sirolimus eluting and paclitaxel eluting stents. They investigated the ability of the SIRTAX score and clinical SIRTAX score to predict long-term outcomes in all comers receiving drug-eluting stents. The SIRTAX score was retrospectively calculated, and the clinical SIRTAX score was calculated using age and baseline left ventricular ejection fraction and creatinine clearance. They then did a comparison for all-cause mortality, cardiac death, MI, ischemia-driven TLR, definite stent thrombosis, and major adverse cardiac events at 1 and 5 year follow-up. Perhaps not surprisingly, major adverse cardiac events were significantly higher in patients with high SIRTAX scores at 1 and 5 year follow-up, which was also seen at 5 years for all-cause mortality, cardiac death, MI, and TLR. Stratifying outcomes across clinical SIRTAX score confirmed and augmented these results. Thus, the SIRTAX score, and to a greater extent the clinical SIRTAX score, were able to stratify risk for very long-term adverse clinical outcomes in all comers in a population receiving drug-eluting stents. Predictive accuracy for 5 year all-cause mortality was improved using the clinical SIRTAX score. I'm Peter Block, and this is a CardioSource Heart Minute.